Our ears are incredibly complex and delicate organs that allow us to hear a wide range of beautiful sounds. However, sometimes our ears can produce sounds seemingly out of nowhere, such as buzzing, ringing, or hissing. This phenomenon is known as tinnitus. Although tinnitus is common, many people don't fully understand it. Today, let's delve into the causes, effects, and ways to address this issue that troubles many people. Tinnitus is a common auditory phenomenon characterized by the perception of ringing or buzzing sounds in the ears, without any external sound source. The causes of tinnitus are varied and complex, including exposure to loud noise, earwax blockage, cardiovascular issues, certain prescription medications, and thyroid disorders. Tinnitus can significantly impact a person's daily life, leading to sleep disturbances, concentration problems, and even psychological issues. Therefore, understanding how to effectively manage and control tinnitus symptoms is crucial for improving the quality of life. Common methods for relieving tinnitus symptoms. 1. Masking ringing or buzzing sounds with sound generators. Sound generators are commonly used devices that help mask the ringing or buzzing sounds associated with tinnitus by producing white noise, soothing music, or other relaxing sounds. Popular sound-generating devices include in-ear devices, over-ear headphones, and white noise machines. Additionally, household appliances like air conditioners, air purifiers, fans, or a low-volume TV can produce similar effects. While sound therapy does not cure tinnitus, it can significantly alleviate symptoms, improve focus, and help patients fall asleep more easily. For those on a budget, using ambient sounds, gentle relaxing music, or streaming services can be an affordable alternative to expensive medical-grade sound therapy devices. 2. Using hearing aids to control hearing loss and mask tinnitus. For patients with hearing loss, hearing aids can amplify external sounds, thus masking the ringing or buzzing in the ears. It is recommended that patients seek guidance from a hearing specialist or audiologist, who can help them select and fit the appropriate hearing aids. Even for those without significant hearing loss, some specially designed hearing aids are available on the market to stimulate the auditory nerve or mask tinnitus with white noise. Although hearing aids can be costly, most health insurance plans cover the basic cost of hearing aids, allowing patients to choose devices that best suit their needs and budget. 3. Consulting with a doctor about antidepressants and anti-anxiety medications. For patients whose tinnitus has led to severe anxiety, depression, or insomnia, doctors may recommend the use of antidepressants and anti-anxiety medications. These psychiatric drugs can help alleviate tinnitus symptoms, making it easier for patients to cope with the challenges of daily life. Additionally, antidepressants and anti-anxiety medications can effectively break the vicious cycle between tinnitus and emotional problems, preventing the condition from worsening. However, these medications may cause side effects such as blurred vision, dry mouth, nausea, constipation, irritability, and decreased libido. Patients must closely monitor their physical condition while on medication and promptly report any adverse reactions to their doctor. 4. Finding a therapist skilled in tinnitus management. In addition to medication, professional therapists can provide valuable assistance to tinnitus patients. These therapists are usually proficient in various psychological and behavioral therapies and can guide patients on how to effectively manage tinnitus symptoms and improve their quality of life. Patients can find experienced therapists or healthcare experts through professional websites like the American Tinnitus Association or Tinnitus Light. 5. Consulting with a doctor about experimental treatments. As medical technology continues to advance, research on tinnitus treatment is ongoing. Although tinnitus cannot currently be cured, patients can discuss the possibility of participating in experimental treatments with their doctors. For example, brain and nerve stimulation through electrical or magnetic pulses may help restore overactive neurons, preventing the transmission of erroneous auditory signals and thus alleviating tinnitus symptoms. Additionally, new medications may become available in the future. Patients should regularly communicate with their doctors or hearing care specialists to stay informed about the latest treatment developments and choose the most appropriate treatment options for their condition. 2. Lifestyle changes to alleviate tinnitus. 1. Reducing noise exposure. Noise is not only a common trigger for tinnitus but also worsens its symptoms. Therefore, patients should minimize noise exposure in their daily lives. When working with power tools, performing yard work, using vacuum cleaners, or engaging in other noisy activities, it is essential to wear noise-canceling earplugs or earmuffs. 2. Maintaining regular physical activity. Regular aerobic exercise is beneficial for overall health, particularly for tinnitus patients. Activities such as walking, running, cycling, and swimming can not only strengthen the body but also improve blood circulation, which may help alleviate tinnitus caused by cardiovascular or circulatory issues. Maintaining an active lifestyle also has a positive impact on emotional well-being. 3. Practicing meditation and relaxation techniques. Stress is a common factor that exacerbates tinnitus. When patients feel anxious or stressed, practicing meditation or deep breathing techniques can effectively alleviate discomfort. For example, patients can relax their nerves through slow, deep breathing while imagining calming scenes to gradually ease their anxiety. Participating in yoga or martial arts classes is also a good option, as it promotes mindfulness and relaxation while offering opportunities for social interaction. 4. Avoiding caffeine, alcohol, and nicotine. Substances like caffeine, alcohol, and nicotine can affect blood circulation and worsen tinnitus symptoms. Therefore, patients should reduce their intake of these substances. For example, they should limit their consumption of caffeinated beverages such as tea, coffee, and soda, reduce chocolate intake, and quit smoking. Additionally, reducing caffeine intake can help improve sleep quality for patients who struggle to sleep due to tinnitus. 3. Treating underlying health issues. 1. Regular medical checkups for accurate diagnosis. Tinnitus is essentially a symptom rather than an independent disease. Therefore, patients should regularly visit a doctor for checkups to identify the underlying causes of their tinnitus. Doctors usually perform physical examinations and hearing tests to determine the root cause, which may include noise exposure, earwax blockage, cardiovascular issues, side effects of certain medications, or thyroid disorders. 2. Referring to specialists as needed. General practitioners or primary care physicians can typically perform initial tinnitus evaluations, but they may refer patients to audiologists or ENT specialists. These experts have more specialized knowledge and equipment to help patients develop long-term tinnitus management plans. 3. Reporting noise exposure to your doctor. Patients should accurately report their noise exposure to their doctor, which helps exclude other possible conditions and allows for more tailored treatment recommendations. If a patient's work or living environment involves prolonged exposure to loud noise, the doctor may recommend additional protective measures. 4. Discussing medication side effects with your doctor. Over 200 medications are known to cause or worsen tinnitus, including certain antibiotics, chemotherapy drugs, antimalarial drugs, and diuretics. Patients should discuss the medications they are taking with their doctor, and if necessary, adjust the dosage or switch to alternatives with fewer side effects. 5. Clearing earwax buildup. Earwax buildup is a common cause of tinnitus. If a patient's ear canal is blocked by excess earwax, the doctor can use medicated drops or specialized suction devices to remove it. However, patients should not attempt to clean their ears without medical guidance to avoid further damage. 6. Managing blood pressure and vascular issues. Tinnitus is sometimes associated with high blood pressure or other circulatory problems. Doctors typically prescribe medications to help control blood pressure and vascular issues. Patients should follow medical advice regarding diet and lifestyle changes, such as reducing salt and fat intake and maintaining regular exercise. 7. Treating thyroid disorders. Thyroid dysfunction is another potential cause of tinnitus. Whether it is hyperthyroidism or hypothyroidism, it can lead to tinnitus. Doctors will assess thyroid function through physical exams and blood tests, and prescribe appropriate medication based on the findings. Patients must follow their doctor's instructions closely when taking thyroid medications to ensure effective treatment. Conclusion: tinnitus is a complex and diverse symptom that, although currently incurable, can be significantly alleviated through scientific treatment and lifestyle adjustments. Throughout the treatment process, patients should maintain a positive attitude, collaborate with doctors and professional therapists, and find the treatment plan that works best for them. By adopting the methods described above, tinnitus patients can better control their symptoms and improve their quality of life. Additionally, with ongoing medical research, new treatment options may become available in the future, offering more hope for those suffering from tinnitus.